Inflammatory bowel disease. Inflammatory bowel disease, a group of chronic intestinal diseases characterized by inflammation of the bowel, the large or small intestine. The most common types of inflammatory bowel disease IBD are ulcerative colitis and Crohn disease. Crohn disease favors the ileum, the lower part of the small intestine, but can occur anywhere along the intestinal tract, while, by contrast, ulcerative colitis affects the colon, the large intestine alone. The inflammation in Crohn disease involves the entire thickness of the bowel wall, whereas in ulcerative colitis the inflammation is confined to the mucosa, the inner lining of the intestine. The symptoms of IBD include abdominal pain and diarrhea. The course is typically unpredictable. Symptoms tend to wax and wane, and long remissions and even the spontaneous resolution of symptoms are well known. The disease can be limited to the intestine or affect the skin, joints, spine, liver, eyes, and other organs. Although people of any age can have inflammatory bowel disease, the diagnosis is most commonly first made in young adults. Intestinal ulcers and bleeding are common in both Crohn disease and ulcerative colitis, but complications such as intestinal strictures, narrowings, fistulas, and fissures, tears are far more common in Crohn disease than in ulcerative colitis. Small intestinal bacterial overgrowth in Crohn disease can result from an intestinal stricture and is treated with antibiotics. Crohn disease of the duodenum and jejunum can cause malabsorption of nutrients, can cause malnutrition, weight loss, and diarrhea. In Crohn disease of the ileum, malabsorption of bile salts can cause diarrhea, and malabsorption of vitamin B12 can lead to anemia. IN F L A M M A T O R Y B O W E L D I S E A S E. Inflammatory bowel disease.